viewers out there. You are on again with Dr. Ehimen Bello on exciting health topics. In our last video, we looked at the classification of hypertension based on the severity. Today, I'm going to be taking you through a journey about the risk factors of hypertension. It is very important for us to know and understand the risk factors so that we are able to adopt preventive measures of hypertension. Kindly subscribe to my YouTube channel for more exciting videos. Age is considered one of the risk factors for hypertension. The older one gets, the higher the chances of developing high blood pressure. In other words, hypertension comes as one grows in age. An age of 40 years and above with other associated risk factors should endeavor to check his or her blood pressure at all times. The second risk factor we are going to consider here is obesity. Obesity is defined as an excess of body fat that is harmful to our health. As your body weight increases, the chances of blood pressure also increases. The fat tissue in our body needs more oxygen and nutrients to live, which requires the blood vessels to circulate more blood to the fat tissue. This in turn increases the workload of the heart because it must pump more blood through the blood vessels, thereby increasing more pressure on the blood vessels. Higher pressure on the blood vessels increases the blood vessels, and as such, hypertension occurs. This is how obesity is linked to hypertension. Family history is another risk factor that increases the chances of hypertension. If you have a family member with hypertension, the chances of developing it is significantly higher. This is usually due to genetics and lifestyle habits. Another important risk factor we're going to look at is diet. When we are talking about diet, we're talking in context with consumption of excessive salt. Excessive salt has been found to cause fluid retention, which increases the pressure exerted by the blood against the walls of the blood vessels. Excessive intake of saturated fats has also been found to increase the risk of hypertension. We discussed the issue of excessive saturated fats when we're talking about obesity as one of the factors that causes hypertension. Cigarette smoking is another risk factor of hypertension. Cigarette smoking causes the blood vessels to constrict, resulting in higher blood pressure. It also reduces the blood oxygen saturation so that the heart has to pump faster in order to keep up, causing elevated blood pressure. Harmful use of alcohol can affect the muscles in your blood vessels. And when the muscles of the blood vessels is affected, it can narrow the blood vessels with the risk of one being hypertensive. The world is filled with increased demand. The wear and tear of mental stress can have serious impact on the blood vessels, thereby increasing blood pressure. In moments of extreme stress, it is normal to experience a spike in heart rate. In chronic stress, your heart rate does not return to normal when it increases. The last factor we are going to consider here is diabetes mellitus. Diabetes mellitus is a condition where one have increase in blood sugar level above the normal due to decrease in insulin production or due to increase in insulin resistance. Diabetes mellitus causes damage to our kidneys, which in turn leads to salt and water retention, and in turn can raise the blood pressure. Diabetes mellitus can also damage our blood vessels, causing the blood vessels wall to stiffen and function improperly, which in turn can lead to high blood pressure. Having known about the risk factors of hypertension, knowing the risk factor will enable you to recognize subtle changes in the blood pressure that signals physiological abnormalities. It will also enable you to adopt measures that will prevent it. In my next video, I will be talking about the preventive measures of hypertension. Kindly subscribe to my YouTube channels for more exciting health topics. Like and share it. Thank you for watching and see you in my next video.